Now, maybe the last time you went to the dentist, x-rays were taken, and you're wondering, what do they do with them? And we're here with Dr. Dunlop right now from Coshocton. And Doctor, obviously they give you a look inside the teeth, but how do you use them? What are you guys looking at? And how often should people have the x-rays done?
That's a good question, and we get that often, of course. People want to try to save money maybe and not do x-rays, but I always explain that really I'm only doing half an exam if I don't have the x-ray. I really can't see most everything in your mouth. I can see the soft tissue, I can see the gums, and I can see a little bit around the teeth, but to really truly have a good picture, I need x-rays to kind of help us see in between your teeth, very detailed, and that's typically where decay would initially start. And so we like to do that regularly. Also, we're looking at your gums. The bone between your teeth is defined a lot of times on the x-ray, where we can make a determination whether you have some type of periodontal inflammation or gum disease. So x-rays are important. It's just an important part of your exam. And, I think it's something that really we try to emphasize here, just to help make sure that you're protected. We don't want to have something crop up that we've missed just because we didn't take an x-ray.
Hey, I'm just curious too, because I know sometimes there's x-ray from this side, and then every once in a while I know I get in the thing and it kind of goes around me. Or maybe are there 2 or 3 different types of x-rays that are, and why? What do each do?
Good question. Yeah, I think most of the x-rays are smaller, where we do called bite wing type x-rays, where we examine in between your teeth. We can do images of the end of the root where maybe potentially you have an infection or things of that nature that we're looking for. And then the big scan thing that we like to use, a digital scan, which is really amazing. It does a lot of different things and shows a lot of different information, pretty much images your whole head and face. We can see oral cancer. We can see bony changes in the joint, the temporomandibular joint. We can see airway management issues. So there's a lot of things that you can pick up in a larger film like that. And that's one that we wouldn't use routinely, but maybe once every 6 or 7 years. But the others, when we're doing just maintenance kinds of things, are pretty important just to help us kind of gauge where you're at.
Well, that's everything you ever wanted to know about x-rays, but maybe we're afraid to ask, and that's why I just did ask the doctor. So thanks so much, Dr. Dunlop. Always great to hear about this stuff.